Good morning, guys. I hope we're all sparkly. Well, it's raining. Does this herald the end of British summer? How miserable. It's not miserable. It's good for the gardens. We need to find a positive. But us Brits, we're a bit negative. We're not like the Americans. Only in America is a positive thing. Here in Britain, disappointingly, it's negative. But we need to shift our perspective. And this goes for testosterone as well, because we know that testosterone is the fundamental anabolic hormone necessary for growth and repair. It's going to allow you to cope with the bad times and make those bad times good times by continued movement forwards towards the light, away from the darkness. It really is that simple. It's all perspective. And if life is about balance and appreciating that contrast is necessary for balance, we're going to get your testosterone levels back up to normal, for the counterbalanced cortisol to react appropriately, and you to be more resilient through the determined effort that you're going to make. It is that simple. Life is a journey. So I had an email from a patient the other day. He says, I think I'm going to come off testosterone replacement therapy. I've been on it for 9 months and I don't feel good. What happened? Well, he had high estradiol symptoms, itchy nipples, anxiety, bloating. But what was it? Well, he's a transfer of care from another online company who didn't really care for him, just prescribed testosterone and gave him crappy advice because they weren't really invested in him. They're invested in this. Yes, your numbers look da-da-da-da. Well, yeah, let's up the dose. What a surprise. You need to be considered when you make decisions about somebody's care, because it has to be holistic. You have to approach everything, not just the numbers and the protocol, which is why we insist on a face-to-face consultation for the initial new patient consultation and yearly thereafter. Now, the rest can be done remotely. Now, we've introduced actually for stable patients after their annual review, they can have remote consultations as long as they cross all the T's and dot all the I's. That means the physical examination, bloods, so that we can effectively advise them at that consultation what is in their best interest. And I've been absolutely shocked and actually humbled by the fact that the vast majority of guys who are traveling the length and breadth of the country still want to come down to clinic for their annual follow-up because they see the value in talking to me. No, it's not about talking to me. It's applying that level of objectivity to their subjective experience. How often do we take time out to really think, how are we doing? How are you doing? Now take a moment to think about that. We don't think about it very often, do we? We're so busy with our psychological stressors that are imposed on us and self-imposed. Now we need to take a step back and be more considered. So what does testosterone do? Well, we know it's the fundamental anabolic hormone necessary for growth and repair. We know it's the counterbalance to cortisol, the stress hormone, which you need. But what do you need? Yeah, you need balance, baby. And you must have contrast in order to establish balance. So this patient, unhappy, 9 months on TRT. Well, actually, he's only been 4 weeks on proper TRT. And what's proper TRT? Microdosing testosterone replacement therapy, using the minimum effective dose in the correct manner to achieve stable male androgen levels. And that starting point should be TSIP and HCG, daily injections to mimic natural physiology, that diurnal variation. You need to feel the peak and trough, and daily injections allows you to do that. But we must carefully and effectively titrate the dose. I would love to get it right every time first off, but obviously we're all different, not special, different. So we have to titrate the dose according to response. Now, I've spoken about this before with regards to the drug effect, and the drug effect can be great or it can be horrible, because testosterone rising, dopamine, great. Estradiol rising, serotonin rising, well, you'd think that would be good, and it kind of is good, but when it gets too high, it results in negative symptoms. And one of those negative symptoms is anxiety. And we talk about testosterone being fundamentally about normalizing physiology, but you can't ignore psychology. So if physiology affects psychology and psychology affects physiology, you can't outthink your physiology. So if your estradiol levels are rising to disproportionate levels, you will feel anxious. That's the very nature of physiology. You cannot outthink physiology. So yeah, We need to carefully and effectively titrate this dose according to response. And he's not feeling very good right now. And we talk about concentrating on the moment, because the moment's all that matters. And if the moment's not very good, yeah, it's pretty miserable. So I've told him to what? Trust the process. Yeah, but I've been on testosterone for 9 months. Well, you haven't been on testosterone replacement therapy for 9 months, really, because you've only been under our care and supervision for 4 weeks, and you've only been doing it correctly for 4 weeks. So this guy went to an online company prior to this for ease, because it's easy, isn't it, online? And life should be easy. No, life should be challenging. So you can do what? Yeah, earn your reward. One more time. But yeah, easy isn't always best. Taking the path of least resistance, thinking the maximum reward is going to be sustainable when it's not, obviously, because effort equals reward. So this guy struggled. He struggled because who was looking after him? Some random online doctor who didn't know this person at all and was just simply reacting to the 5-minute telephone conversation and the blood work. They don't have a true understanding of what's necessary to be an effective doctor because they can't. They don't see the patient. They don't physically examine the patient. You cannot assess somebody like this. It doesn't work. So this guy was unhappy. He was on, I don't know, twice weekly injections. I won't name the company, but they're a big company. They're not interested in you. They're interested in this because it's a business. It's not a doctor-led company. It is a businessman-led company with some doctors. They might dress it up and make it seem as if they give a shit, but I can assure you they don't, because they can't, because otherwise they would have a healthy doctor-patient relationship. So this guy, I phoned him up yesterday. What am I doing phoning patients up who are desperate? Well, they're desperate. So actually I thought, right, this guy deserves a telephone call ad hoc from the doctor on his day off. Boom, kill me now. So listen, I do care, but I want the best for you. So it's not about placating you. It's about effectively advising you what's actually appropriate. So yeah, we had that very frank conversation about the testosterone, dopamine, estradiol, serotonin, the fact that you weren't on a proper TRT protocol before. You're now on a proper TRT protocol, but we need to give it time to allow the drug levels to stabilize before I can effectively advise you. So yeah, this guy was pretty glass half empty with these high estradiol symptoms, nipple tenderness, anxiety, bloating. So I said, listen, it can't all be this negative. So what else is going on? How's the libido? How's the erections? Oh, well, they're brilliant. They're much better. Okay, well, that's a win. How's the sleep? Oh, well, that's much better. So it's not all bad. Now, when we're struggling, we do tend to concentrate on the negatives, and that's obvious because we don't want to be negative. We want to be positive. But sometimes there's inevitability about what's happening to you. You can't always dictate what's going to happen to you, but you can dictate your reaction to a situation. And if you have an understanding of what you're doing and why you're doing it, and placing your trust in somebody that knows what they're doing because they're invested in you, not this, then you can take that level of reassurance and move forwards again, away from the darkness towards the light. Now, you must trust the process, because it's been done thousands of times, and we will always act in your best interest, because there's no point me not acting in your best interest. Upping the dose for more money, adding this in, selling you a weight loss medication when you should be looking at calorie counting and moving more. These medications that are just pushed towards these patients are again the path of least resistance. Maximum this for the company. It's completely unethical, but what are you going to do? We live in a world of consumerism, whereas we want at the Men's Health Clinic a doctor-patient relationship because it's long-standing. And again, if I act in your best interests, whose interests am I looking at? Yours, not mine. Now, I want an easy life, don't get me wrong. So the process is very structured for a reason. So I can help you when I can help you. I can't help you when the drug levels are not stable. We give you enough information to make an effective decision as into what you should be doing. So get on with it. Go earn your reward.